Okay, welcome back. We had a change in schedule. Presenting right now will be Sherry and Hillary from the Stanley Milner Library social work team. They'll be presenting on all their services that they provide out of the Stanley Milner as well as a couple other branches as well. I'll leave it to you guys. Thank you.
Hello. Big crowd out there. Just kidding. So my name is Hillary. This is Sherry. So obviously what we're going to talk about today is the work that we do and how we do the work that we do and how you can best support your clients to access our services. We'll also talk about the history of how we came to be in the library and yeah, other stuff like that.
Okay, so just before we talk about what we really do, we wanted to give a little rundown on the history of the program. So the program at EPL has only been in existence for 5 years, since 2011. It was based on a provincial grant, the Safe Communities Initiative. And one of the original social workers is still with us. His name is Jared. So that was really, EPL wanted to be a part of the solution to what was happening in the inner city. They were seeing a lot of marginalized, vulnerable people using the library, a lot of people who are homeless, in poverty, low income, stuff like that. This was because a lot of people find it to be a refuge, a safe space. It's a destigmatizing space, and it's free. And you can kind of relax and have some refuge from the streets or the drop-in centers that can be a little chaotic at times. So that's why EPL created this program, and once the grant was up, after 3 years, EPL actually took it on themselves and decided to continue it because it was so successful. So that's just a little bit of the history of our outreach program at the library.
Okay, so if there's a few people in the audience who we have worked with before, so you guys would know like how we collaborate with clients. So essentially, we meet clients basically because they come into the library because they have nowhere else to go. And then we go out and meet them, get to know them, and develop a trauma-informed, harm reduction-based relationship with them. So we really come from strength-based and anti-oppressive social justice perspective, and that creates kind of a space for people where they feel like they can be themselves, they are welcomed. We use unconditional positive regard. We really want people to feel safe in our space. That is our #1 priority, that when people leave our office, they feel like Hillary, Sherry, and Jared care about me, they value me, I'm an important person. Our services are not contingent upon if you want to use or not use or whatever's going on in your life. You can come and see us. We will work with you wherever you're at. So that is kind of the perspective in how we work with people, but our relationships that we build with people are always intentional. So we never just want to like hang out with people and end up doing nothing to forward them in their life. We really look to network and get to know the resources around us and connect people to those resources. So often we meet people, and we actually seek to meet people who are the most heavily marginalized. So they don't have access to health care, they likely don't have a doctor, don't have an income, they might live outside or stay at the Hope Mission. So intersecting variables of marginalization and incredible barriers that these people face. So one by one, we work to break down those barriers within the context of relationship, connecting people to doctors. We often use the Boyle Macaulay Health Center. They have the best doctors and nurses ever. So we go with people to these appointments and just try, as you know, getting people on an income. They need a doctor's note to say that they can't work. So we can get them that note to say that they can't work, and then we work to get them an income. Alberta Works welfare can be quite stigmatizing and scary for people to access, So we do often, if the person is willing to go by themselves, that is so awesome, and we encourage that. But if they need us there for that extra support and advocacy, we are more than willing to go with people, 7 in the morning, coffee in hand, and line up and make sure that people get the income that they deserve. Once we can access an income for people, then we work to access housing. So that's when we really rely on the resources through Homeward Trust and Bissell and other housing resources around the inner city. We get to know resources, and we get to know the people who work there and try to develop relationship and really try hard to work collaboratively. One thing that because we do all this because we actually don't have resources in the library. We don't have like a housing program or income or any money to spend, really. So we have to rely on the resources that the community offers. So part of why we work this way is we found that it really does work for people. People continue to come back and knock on our door and say hi. Even if we do access housing for people, they still come and want to spend time with us and share their successes with us. We found that working from a trauma-informed perspective definitely resonates with people and works for them. Yeah, so that is, I guess, how we do the work that we do. And we really do rely on the resources of the community. One thing that we could offer you, if you, as a community resource, needed something from us, we do have a lot of knowledge of how resources work in the community. And so if you called us and said, I have a client and they're highly vulnerable and this is their situation, if you've already built up that relationship with the person, it might be valuable for us to meet them. It also might be scary for them. So if you wanted to call us, we could give you kind of like a game plan on some steps to take or some phone numbers of people who could help you. The other option you could have is to send them our way. The only thing that we ask if you send people our way is to give us a heads up that someone is coming and what time they might be coming at, because there is only 3 of us. And so our biggest fear is that someone who's vulnerable would come to our door, knock on the door, and have nobody be there. That's like a scary thing for us, is to have someone who's very under-resourced and marginalized and oppressed feel like, okay, I've been left in the dirt again. So we often do work in the community, and they're sometimes out and about, and there's 3 of us, and we're all like Energizer bunnies, so we're all over the place at all times. So if you could call and say, I have this person, I think that they would do really well with you guys because they come to the library a lot. We would love to talk to you about them and just see how we can help and what kind of things that we can think of. We don't have resources behind our doors, but we do offer relationship for people, and we have a lot of knowledge of how the inner city works, and we know a lot of people in the inner city. Yeah, so I guess Sherry will go into a little bit more detail about how exactly to access us, and we also have cards, if you would like that. Okay, here's Sherry.
Yeah, so just more practical notes. We do have drop-in for any new person Monday mornings and Friday mornings. I like to tell people to come earlier than later because some people show up in noon and then drop-in is kind of done. And sometimes we can get really busy on those mornings. So definitely if you can encourage clients to come during that time, just tell them to come a little earlier because we can get really busy. Generally, like Tuesday to Thursday, like Hillary said, we are out and about in the community. We have appointments. We might be going to the doctor with people, might be going to Alberta Works with people. So we do know that sometimes people show up during that time and they can't access us, and that just really sucks. So Monday mornings and Friday mornings for sure. And just along what Hillary was saying about calling us, giving it a heads up, email us, it doesn't matter how you contact us. just let us know if there is someone you want to collaborate on, and we can work with you to elevate this client that you might have. Also, we do go to other branches. I go to the Abbotsfield branch Monday afternoons and Tuesdays, and Hillary goes to Woodcroft on Wednesdays, and Jared goes to Sprucewood on Thursdays. So if you do have clients that you know are more in that area, just contact us and we can certainly set up a time to meet them at that branch instead of downtown. So that's a little bit of a different process, but just get in contact with us and we can certainly see them. And really, I mean, that's about it. We don't have a big intake form thing. We're just like, we just welcome people and we have a conversation with them, find out what's going on, and then just go from there, kind of. So that's what we do, and we really do like collaborating with other services. And what we want to do is elevate someone so much that we eventually don't have to work with them. Maybe they get housed, and maybe, you know, they're protected by all these other services. But we certainly love seeing like our old clients come by and like talk with us and stuff, and people do tend to come back because it is a safe and welcoming space. So that's really how to access us. Do you have anything else to say about accessing us?
Yeah, I think other than if you have a client in mind who's highly vulnerable, I think it's really important to keep in mind that our focus really is those like highly, highly vulnerable people. So from our perspective, if someone has a home, has an income, has a doctor, we are like, that's amazing. That for us is not someone who's really needing our services. That might be someone who needs like social programming or counseling or mental health therapist, but not necessarily us. We really are looking to connect with the people who are heavily under-resourced, and so they have a great state of vulnerability and marginalization, so that we can connect them to resources and reduce their vulnerability. That really is our main goal. And yeah, we do that through relationship. So I think that is all, but we do love questions if anyone has any questions. Oh, yeah.
Woodcroft on Wednesday, and I'm also at Abbotsfield on Tuesday, so I'm there for a day and a half because it is a high needs area, so that's why I'm there a little.
Yeah.
And I was kind of wondering too, so I know you said for those locations it's better to kind of call ahead and arrange something, but I just see that not really working well for a lot of the clients that would prefer. They're probably not going to book an appointment, make a time to kind of come in. Like, can they drop in at those locations?
Oh, like at like Abbotsfield or Woodcroft, you can, it's just, so a lot of my clients at Woodcroft, they stay in Coronation Park, they live outside in Coronation Park, so oftentimes I'm in Coronation Park, like I bring everybody Dairy Queen, so if they show up, I might not be there. So maybe if you called me and said, what time are you going to be at Woodcroft on Wednesday, I would say, okay, I'll definitely be there between 1 and 4. And then the person can come in between 1 and 4. Yeah, that would probably be best for that kind of situation, because it is true, like some people probably won't call us, that we try to rely on like the resources, the person who they trust to make the appointment, and then we'll take it from there. But yeah, we could let you know exactly when we would be there. But at Woodcroft, I'm often in Coronation Park with my boots on, bringing people Dairy Queen. So. Yeah, they'll at least be one of us. I am 80% certain of. But you could even text and say, is anyone there on Monday? And I could say, what do we have? Yeah.
Because I'm at Abbotsfield a day and a half, there is a better chance of like drop-in, just kind of working. And the clients I have out there are a little more inconsistent. So yeah, if you know people are over there, definitely just send them to the library. I can't guarantee that I can like sit down with them for an hour, but if I even meet them and like start that relationship, that's like totally fine.
Monday afternoon.
And Tuesday, yeah.
Any other questions? No?
Okay. Thank you.
Thank you. Thanks.
Wonderful. Thank you to you both. We'll have a small break so we can set up. And next will be Jody from 24/7 Crisis.